You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. He is Tampa's go-to implant dentist, Dr. Keenan Osman. Dr. Osman, welcome to the program.
Thank you for having me.
Now, I know you brought a stack of photos, so we're going to get to as many of those as we can. But for people that don't know your practice, like who's the typical dental implant patient, the people that are coming in for a brand new set of upper and lower teeth?
Well, Randy, if I had to sum it up into two groups, you have the first group who are patients who have a mouth full of teeth that may have cavities, chipped teeth, broken teeth. They have gum disease. Maybe they have foul mouth because of the bleeding gums.
What do you mean gum disease?
Their gums are bleeding whenever they're going about their day. If they're brushing their teeth, if they're eating food, they notice that their gums are not healthy. And for those patients, they come in, we check the condition that they have, and we bring them in. We pull out the teeth if they need to be pulled out.
Okay.
And we give them a brand new smile. They walk out the same day with upper and lower teeth.
Okay.
Then there's the second group. Those are the people who it's incredibly difficult to get them through the door because they've gotten so complacent with what they have. And those are the denture wearers. The denture wearers are just, they've given up. Someone's told them, maybe a couple of dentists have told them they don't have enough bone. And those people come in and they're kind of already down and they're just trying another thing, and they come in and we tell them that they're eligible and they're a candidate for implants, and they are ecstatic. Those people come in with no teeth, we give them their new teeth, and they walk out with a same-day smile, top and bottom. Now they can eat, now they can chew. They haven't eaten some foods for many, many years. I have a lady who came in for 20 years, she was wearing a denture, and she was told by many people that she was not eligible for this.
But isn't that true? I mean, if you've been wearing a denture 10, 15 years, you can't do this. You don't have enough bone.
Absolutely not. Let me tell you, Randy, this lady, she came in, she said that many dentists told her in the last 20 years that she didn't have enough bone and she wasn't a candidate. We saw her the same day, we put in her teeth, she walked out, and she came in a couple of weeks later and she could not stop talking about how she loves her new smile.
So when we think of Florida, right, because we're here in California, you think of just a healthy group of people. Are there really that many denture wearers there? Are there a lot of them?
I think there's at least 1 million denture wearers in Florida.
Really?
You go to the grocery store, you say hello, there's the chance the person you're speaking to is wearing a denture and you don't even know. Those people probably don't eat the way they want to. There's a lot of things that they're missing out on. They go to meet family members, they have to cover their mouth, they have to eat certain foods that they're scared maybe their dentures might come out. We help those people. They come in and boy, are they happy that now they can eat and chew and live, and they're meeting people and they're confident again.
So these denture wearers, if it's so good to get a new set of upper and lower teeth that don't come out supported by implants, why aren't they all doing it? What's your take?
Well, there's a lot of misconceptions. Why do people not get implants? Number one, they think it's expensive. Number two, they think they don't have enough bone. Number three, they're tired of going around asking dentists if they have enough bone and getting let down every time. When we successfully get a denture wearer to come in the door, for us it's a good day because we know that we're able to give this person news that they probably haven't heard before. And that for us makes us pretty happy.
Correct me if I'm wrong. The way dental implants are typically done is you go to one doctor's office that does the surgery, the implant. Then you go to another office where they put the teeth on top, and then a third office where they maintain them. At your office, you do all three parts. Is that why you do it so quickly?
That's why we do it so quickly. That's why it's affordable. That's why I'm in control of every step and I can ensure the quality of the outcome. I think that if you had to go to 3 different people for the same step or for the same thing, then people are pointing fingers at each other. Maybe people don't know who to ask to fix what problem. I like that we do it all under one roof because we're in control of the price and we can maybe give more people access to this treatment. And also, I can make sure that it comes out the way I want it, and more importantly, the way the patient wants it.
So you have, now when you say you print the teeth in the next room, what does that mean?
So we have an in-house lab at our office.
Okay.
Every step of the process is done with us, and so next door we have a printer, and on the day of surgery when we place the implants.
When you say printer, you're like it's like a machine that makes the teeth.
Yes, we make the teeth in the office so that when we're done that day, the patient walks out with their teeth and they're screwed in and they don't come out.
All right. How soon can they eat if everything goes right?
They can eat as soon as the numbing wears off.
Okay.
They are, they have to keep a soft diet just because for the first few weeks we have to let the implants heal. But after that, we give them their zirconia permanent final teeth and they can go eat whatever they want.
Like what?
Oh, Randy, they can eat corn. They can eat corn on the cob. They can eat, if they like pistachios and nuts, they can eat that. People usually look forward to eating salads for the first time in a very long time. Randy, when you have bad teeth, the normal everyday food that we don't even think about, people can't eat. Things like salads, any kind of steaks, any kind of meats.
Like a chewy pizza?
Absolutely no. Oh, let me tell you about pizza. That's the first thing that a lot of my patients tell me they want to go eat, because they've been craving it. They haven't eaten it for so long. And you would think that they want to go eat all the hard things like pistachios and nuts and seeds and corn on the cob and things like that. But people they can do that too. But really, what they're really looking forward to is the pizzas and the salads.
Is that right?
Absolutely. And then what ends up happening is over the years they've got other diseases because of the food that they haven't been able to eat. So, I mean, not having the best teeth in their mouth has also affected them in other ways, and now they can go and reverse that and kind of add more years to their life happy years.
How old can you be? How old can you be at the upper range?
When I started this, I thought maybe 70, 75, but let me tell you, my oldest patient was 95 years old.
Why would a 95-year-old want to do this?
Randy, she couldn't eat, and she wanted to eat the food that she wanted, and I couldn't blame her. I mean, I eat salads every single day. I like pizza. I love pizza, and that was the first thing she wanted to eat. When she sat in the chair, I told her, "Do you know what I'm going to do for you today?" She said, "Yeah, you're going to give me the ability to eat whatever I want." And we all laughed because it was the first time we heard it like that. I think that when we have teeth and we take it for granted, we eat whatever we want, we don't think of people who can't. And that's what this does for them. It gives them the ability to eat.
So a 95-year-old can do this. So when a 75-year-old is at your office and says, "Doc, I'm too old," not even close?
Not even close. And I kind of smile.
Do you hear that?
Absolutely. I hear that from 65-year-olds and 55-year-olds, and I kind of just smile and let them, I listen for a little bit, and then I explain to them they have 40 years ahead of them of living, and they've only lived half their adult life. And I kind of try to walk them through and tell them, listen, I know you think you're old, but I know that you're not, because I have other patients who are much older than you. I remember one of my patients, she's 85. And let me tell you, after she got her new teeth, she lit up like a light bulb. She was so happy every time she walked in. She started reminiscing about when she was younger and maybe 40 years before, and how she had a farm and a pasture. And I was wondering, why is this lady telling me her old story? Okay. And I recognized she felt 40 years younger just because of these teeth. And it's not something that I would have thought of, but I'm learning a lot as I'm giving people new teeth, that they physically feel younger and their brain feels younger, and they start remembering the things when they were younger and the things they used to eat and do and the way they used to live. And it just supports that people who get new teeth, it transforms them.
Now we talked on the phone, and you said that some patients come in and you think they're one way, then after they get their new teeth, you realize that they're another way. Can you elaborate on that? Or
Absolutely. They come and they're a little down and their energy's low and their personality's kind of quiet, and you don't see them smile because they don't like the way they look, and you don't feel the energy. And then after you give them teeth, it's like they woke up again. It's like you breathe breathe life into them. Now they're walking in, they're animated, and they're the way they speak, they're smiling from ear to ear, and they're telling me about the new job they're going to get, and they tell me about the what their spouse is saying, what their kids said, and what their family is saying about the way they are, and how it changes everything. And I think it's a new life.
Do you ever have partners that do it? Husbands, wives?
Oh, those are my favorite. I love it. So actually, off the top of my head, I can remember 3 couples who've done this in the last 2 months. They walk in the office and they'd sit down and we tell them this is what we do, and they both get it done, and that's actually for
Who goes first usually?
Definitely. Let me think. Who goes first? I'd say the woman goes the wife goes first, because the husband wants to see. And okay. I think usually the husband's a little chicken. But also, I like one person going at a time, because they take care of each other throughout the process.
So older couples.
Older couples, 60. Yes.
Because I guess when you're retired, you want to travel and eat.
Yes. The thing that people look forward to for their whole life is retiring and traveling. Imagine going to a country that, you go there, you see all the nice things, but you don't get to try the food there.
Does that happen? Do patients tell you that?
Absolutely, that happens, and we have to make sure we get them into finals before they go to Italy and Greece, and it's kind of the joke, but it's true.
Are they afraid of pain? Because it does seem painful.
Let me tell you, I understand the fear, and it's a legitimate fear. However, with numbing them and with IV sedation, it has changed everything. I love answering that question in the office, because it just puts me on top of the hill when I tell them that I can give you IV sedation, and you won't remember much, and you won't feel much, and you'll be incredibly comfortable. And
is it safe?
To me, it's the safest way to do it. Yeah, I would rather work on a calm patient who's sleeping.
What about statistically?
Statistically, absolutely. Statistically, when you work on someone who's calm and they're numb, they're much more safe than if you're working on them and they're numb and worried and nervous and anxious.
Now, let's take a look at some of those photos.
Oh, sure.
What do we got?
We can go through them. This is the first one.
All right.
So this patient came in and he had gum infection. His gums were pushing his teeth out of his mouth. He couldn't eat the way he wanted to. He couldn't smile the way he wanted to. And he was missing his back teeth. So he came in and he asked us if we were able to help him. And absolutely, he had the bone. We cleaned out.
Was he worried he was going to end up in a denture?
Oh, he's worried out of his mind that he's not a candidate for this procedure. And the first thing I did was, take the scans, check his mouth, tell him, don't worry, we can help you, and we can remove all this infection out of your mouth, and we can give you teeth again.
Okay.
And he didn't believe it because of the way he came in. And sure enough, let me tell you, the way it finished was phenomenal. He was incredibly happy.
What did you do for him?
We took out all of his infection. We took out the teeth. We placed the implants for him, and we gave him teeth the same day.
Very nice.
Oh man, it was one of our most satisfying results, because when he comes in, he probably never forgot how he came in because of the dramatic difference. So he actually, it took us about 5 minutes to get him to smile because he wasn't used to smiling. He had to close his eyes and exaggerate to be able to just see some teeth because he was so nervous and he was so anxious. Now, that's just the day of the procedure. That's we did the surgery in the morning, we finished, we took pictures, that's what you see. Those are the temporaries.
So he walks out with teeth that don't come out.
He walks out with teeth that don't come out, and he can go eat, he can go drink, whatever smoothies he wants for the day because he's still numb. The next day, he go at it. Have anything that's soft.
It is a big difference in the appearance. What does he say? Like, what do people, maybe not him, but what's it like when they look at in the mirror for the first time?
You get a couple of different reactions. Some people just break down in tears because they're so happy. They can't believe what they're seeing. It's a different person, and then they're incredibly happy at how they were and how they are, and it happened in the same day. The instant gratification factor is real. Then other people just can't stop looking in the mirror, and they don't want to, they don't want to give the mirror back. And then other people go back immediately to their spouse in the waiting room, and they just start, jumping up and down, look at me. And all the reactions are very nice, but some people jump up and give us a hug, and kind of one by one, and it's nice. It's a good feeling.
Teeth like that on his before photo. I'm not criticizing him, but that has to be unusual.
It's not his fault. This is not something that he could have brushed away. This is not a cavity that you just make sure that you floss in the morning, floss at night. It doesn't happen. This is a gum infection. This gum infection might happen over the course of years, and it might be even genetic. But he doesn't see this either.
So teeth like that are common?
They're more common than you think. And people who have them might not even know because they don't smile, because they don't like the way it looks. And
so people like this are all over the place, but they just don't smile.
Absolutely. People like this are all over the place, and they don't know until they come in and we explain to them what's happening.
Do they say, Doc, this is the worst you've ever seen?
Every single one. They think that
really?
They're the worst case on planet Earth, and we just smile and tell them, no, don't worry, we'll take care of you, we'll fix it, and reassure them, and usually that helps a little bit. But it's not until they see thereafter that they're just out of the park.
Let's take a look at that next photo.
Oh, sure. Oh, this one's good. I like this one a lot. She came in, and every single tooth in her mouth was broken. Every single one was chipped. She couldn't eat or drink anything without it hurting. These people, you think that they can't eat, but they also can't drink cold anything. This person...
Why is that?
Because they're inside your teeth, there's sensitive nerves.
Oh,
and
it hurts.
And it hurts a lot. And when the teeth are chipped and broken and the nerves are exposed, and you can't eat or drink cold water, you can't have a soda, you can't have ice cream, you can't do anything. Even the air you breathe through your mouth kind of hurts a lot.
Is that right?
Yeah, they breathe through their nose with their mouth closed because it hurts.
So her options would have been what?
She could get a cosmetic denture, but there's no way she's going to do that. That's why she came to us.
Okay.
She came in and she got implants top and bottom, and she got a smile on her way out. We had to remove all the chipped and broken teeth, and now she could eat again. She could smile. She never smiled before. She looks like a completely different person, and to me, she looks a lot more attractive after than before. She must have lost at least 15 years off of her face just by getting new teeth. And when I say she looks more attractive, I mean that everyone, when they get new teeth, they look younger, they look better, they look nicer, and people are happier, and so they're smiling more, and people smiling, that looks good too.
That looks very good. And are you in on the design of what these teeth are going to look like?
Let me tell you, I'm on the phone with my designer before, during, and after. We make sure that we plan every case custom made, no cookie cutter here. And we measure in millimeters how much they're showing when they smile, how much we want them to show, what we want their teeth to look like. Sometimes they even bring in a picture of when they were younger, what they want us to make it like. It's full customization.
What do they like more, how it looks or what they could eat?
Well, that's a good question. I have an example of both. I have this one lady, she came in all the way from Georgia. We're in Florida, so she had to, I think, 10-hour drive. She came in and she would not stop telling us how amazing ice cream was the next day. She had not eaten ice cream in 25 years.
Okay.
And she was raving about the new food that she could eat that she wasn't able to eat before. That's one person. Now, of course, she couldn't eat, and that was why she came in. But she, you would think that she would like the way she looked, but she paid no attention to that. She was just concerned about the food. Now, another lady was only concerned about the way it looked. She was traveling with her family to another country to meet her extended family, and she hadn't seen them in like 15 years. So the first thing that comes out of her mouth, which is why I remembered it, it was over a year ago that we saw her, she said, I can't go home to my husband's family looking like this. They don't know this version of me. They need to see the version of me that they used to see, 15 years ago. And that was slightly intimidating, to be honest. But then it was clear after the surgery, she did her summer vacation, she came back. It was as if her dreams come true. She was done. That's all she wanted. And then when she got into finals, she said, I forgot about the pizza and the salad. That's all I like to eat back then. And so, sometimes it's one before the other, but ultimately it's both.
Is that right?
Absolutely.
Now, okay, time for more photos.
Sure. This is a good one. So this patient comes in, and he had a cavity on almost every single tooth. He had missing back teeth, and he could never smile. He could not eat. And he was telling us how difficult it was for him to even have his own friends see him because they're not used to seeing him this way, and it's been years. So he isolated himself socially. He's not able to eat the food he's supposed to eat. His option was denture, but absolutely, we don't do dentures. He came in and boom, we gave him implants with teeth, and he walked out same day.
That looks very nice.
Now, Randy, look at the before and the after side by side. Would
right.
you say that the one over there looks, the after, would you say that one looks more handsome?
Yes.
Well, that's the way everyone's after is. This guy can go now, and he can go to Burns, and he can eat whatever steak he wants. Before, he wouldn't even dare set foot in Burns because he's too scared to eat anything.
So the teeth get really, really loose. So they can't bite things.
They can't bite things. They can't chew anything besides soft food when they're not able to enjoy their teeth.
So he would have got a denture. It's hard to believe. So young people are wearing dentures?
Oh, I have denture wearers who are 25 years old.
Is that
And they
right?
come in, and it just breaks my heart because I know in my mind, had I seen them before they got their denture, we could have put them in teeth that they could last for the rest of their life.
Now I'm going to rush you a little bit. We have time for a few more photos.
Sure. This is the next one.
All right.
This lady is a little personal for me. I've known her my whole life.
Oh, okay.
And I never thought anything of it. I never seen her smile. And the day she came in the office, and I had to actually formally ask her to smile, I said, wow, I've never seen that picture of her in my head.
How do you know her your whole life?
She's my friend.
Okay.
And so she comes in, and I had not thought anything of it. Now I see her smiling. I said, there's so many things we can fix. This is going to be amazing. So what do we do for her? We take out her teeth. We take out her partials. We throw them in the garbage. We give her implants. We print the teeth for her. She walks out looking just like that. Same day.
That looks nice.
It's amazing. The instant gratification factor is really one of the best things about what we do because they come in one way, they walk out completely different.
Have you talked to her? What does she like most about it?
Oh, she loves her smile. She actually went and she went out of the country for 3 months, and that we gave her all the parts she might need in case anything happens, but she didn't eat anything. And she didn't need anything. She ate everything.
Okay.
And so she comes back and, she's happy as ever. She went, she saw her family. She spent time there. She didn't want to come back, but she wanted, she had to do it.
How many years since you know this person, how many years did she not like her teeth?
I must have known her for over 20 years.
20 years she didn't like her teeth?
No. I never
Didn't
seen her
smile?
I never seen her smile once.
So you thought she was what, serious or grumpy or what?
No, I just thought that's the way she was. I mean, I'd known her my whole life.
What
so
about now?
Now she walks around and she smiles and she shows her teeth out to everybody, everyone she sees.
That's very nice. Time for a couple more.
This one's a good one. So this one comes in. She had loose teeth. She had gum infection. She didn't like the way her bite was. She didn't like the way her smile was. She didn't like the windows.
What do you mean she didn't like her bite? Like the way the teeth come together?
Yeah, the way the teeth came together very, they were lopsided. They kind of didn't come together the way they're supposed to. The bottom teeth were flared out. The upper teeth were flared in. There's a lot of things that you'd want to fix. And they were loose too, so they were infected. And she was missing a few teeth too.
So you couldn't save those teeth?
I couldn't save them. No, they were not savable.
Okay.
And she comes in, and she's the one who the first thing she says is, I'm going to go see my husband's family. I can't be looking like this. I need you to fix this as soon as possible. And she drove from 4 hours away.
That looks good.
She was.
I'm not trying to side with you, but
Look,
it looks
Randy,
good.
everyone looks good when they do the surgery. Everyone looks good when they walk out and they have their teeth on the same day. She came from 4 hours away, and she came 10 more times after that because finally we got her in finals, and now she can eat whatever she wants.
Very nice. Very nice. Time for a couple more.
Sure. This one, I remember this patient very well. He came in, and believe it or not, he's 82 years old at the time. Now he's probably 86.
He's looking good, by the way.
Oh, he looks fantastic. And he did not realize how bad it was until I showed him that picture because he never seen them himself.
The before photo.
Yes. He came in because he wanted us to re-cement his bridge. He thought that his bridge was loose. And when I showed him in the mirror, it's not your bridge, it's your teeth. Your teeth are loose. Then he kind of, he had no idea. So he did the same thing. His option would have been a denture. That's the option that he would have got if he went to any other practice.
Okay.
But no, not we didn't do that. We pulled the teeth out. We gave him implants. We printed his teeth for him, and he walked out looking just like that.
That looks
By the way,
good.
Randy, all these pictures are taken on the same day.
Is that right?
We catch them once on the way in and once on
What
the
do
way
their
out.
friends say? Family.
They can't believe it. They are.
Do you ever speak to some of the family members
Yes.
that are involved in
Sometimes
the
the family members themselves call our office and they tell us, I just want to tell you that so-and-so is a different person. It's not even just, oh, they look good. No, they don't just look good. They're a different person. Their personality lights up.
They seem happier.
They seem happier. It's hard to put it into words, but they're lively. They're enjoying their life. They're traveling more. They have more energy. They love everything about
As
the way
you're
they look.
talking about this, I can't help but think that in life, it's like if you don't like something about yourself, it holds you back. So
Absolutely.
that's behind them.
Their whole personality is held back. Their demeanor, their energy level, their desire to do things is completely held back. It's like paralyzed. And then you give them these teeth and it's like, boop, it's like a light bulb. Finally, they want to do everything now. Now their spouses can't keep up with them.
We are short on time.
Okay.
But I have to ask you about...
I only have a couple more.
Okay.
Let's just go through them.
Okay, we'll run through those. But I got to ask you this, and I know I'm going to try to rush you. I know you want to show more photos. But even the best dental insurance doesn't cover this. Medicare, Medicaid does not cover this.
Randy, most people come in and they're financing it.
Is that right?
Absolutely. And our office offers them a range of options. We try to access every person who comes in. We try to give them an option of something we can do to make it better.
So it's not just your office. Is this true that across the country, like 80% of people doing this are financing it?
Absolutely. Randy, it's like anything else in life. When you really want something, you save up for it. And that's what they actually do.
They come back.
Absolutely, they come back.
Do they accept co-signers on the financing?
Yes, that's the way it works, Randy. When your credit's not high enough as much as you want it to be, you bring a co-signer. And you know what? When they really want to get this done, they figure it out.
They do it. Okay. Time for a couple more. I'm going to rush you a little
Sure. This one is one of my favorites. I know I've been saying that for every picture now, but honestly, you asked me to bring my pictures, and I brought all my favorite patients today. I had to scramble and find some pictures last minute. So these are the ones I came up with, but I really like this bunch, and I like all of them, but this is what I had.
What's going on with her teeth? Because they look pretty good.
So she had front teeth and no back teeth. Her front teeth looked kind of nice, but when she smiled big enough, you could see they were missing in the back, and she wanted to fix that. So she actually came in and she was lively on the first day. I said, oh, this one's pretty happy. I don't know how much happier she can be. But lo and behold, after the surgery, she was bouncing off the walls.
So no back teeth means what?
No back teeth means you can't have the food that you're supposed to have, the healthy food, the fiber, the vegetables, the fruits, the things that you're supposed to eat to be healthy.
So with this woman, she needed a denture.
She needed a denture, and not only that, when you chew on your front teeth long enough, they get loose and they also have to come out.
Okay. So what'd you do for her?
We gave her upper and lower teeth supported by implants.
This looks good.
It looks beautiful. She's ecstatic, and she brought in 5 of her friends just because of the way that they saw her. They saw her smile after surgery, and they said, "Hey, come, we want to go in too." And I remember her friends too, and she's a special one.
They look natural, by the way.
Well, remember, every patient has a custom designed smile for their face. We have so many records that we take before we start because it all has to match the face. And sometimes people have specific requests. Sometimes they walk in and they say, we don't even know what we want. And that's when we really go to town.
Do they clean them just like regular teeth?
They brush them. They use a water pick. And then they have to come in every 6 months so that we can make sure everything looks good.
Just like a regular...
Just like a regular cleaning, yes.
Okay, good. Time for one more.
This is the last one we have. This one is also...
Your favorite patient.
Well, they're all my favorites. Okay. But she came in, and what struck me the most about her was she was very young. And, people come in thinking they're too old. Well, she came in saying, I'm too young for this. And she was right. We gave her implants that, right then and there. We did her scans, we did her, all the things that we're supposed to do. But she had gaps, she had loose teeth, she couldn't eat because her teeth hurt, because whenever she bit onto something, her teeth moved and that hurt her
So
gums.
what, she had severe gum infection?
She had severe gum infection, yes.
So you remove that,
Yes.
give her new upper lower
Absolutely.
teeth.
We remove that, we clean everything out, we give her teeth that look beautiful, and she can go and she can smile and she can eat. Now, this particular patient was more concerned about her smile because she was so young and she couldn't smile
It's
anymore.
a totally different look.
And she told me when she came back, she said she has to get used to taking her hand off of her face when she talks because now people can see her teeth. And she's walking around smiling.
Is that right?
Absolutely. And honestly, I couldn't agree more. I think that over time, people get used to the way their teeth look and they don't like it. And so now they're forced to cover their mouth when they talk.
Did she feel judged before with that?
That's usually what they say, yes. And she did that too. She said, people who have gaps in between their teeth and their teeth move and they can't smile, obviously they don't smile because they feel judged, or they don't even like their smile themselves. They're too embarrassed.
So what, and my final question, because we're out of time, but what are the steps to getting the new teeth in your practice?
Randy, in the last 5 years, digital technology has come out such a long way. Now it's 3 steps. You come in, we determine if you're a candidate, we do your smile design, and then we give you your teeth.
Is that right?
It's grown leaps and bounds over the way it used to be, and now I think there's no excuse not to do it.
If somebody's watching this, right, whether it's online or wherever, that next week, if you had an opening in your schedule, bad teeth and gums next week, they could have their brand new upper and lower teeth.
Well,
Is that true?
I can do you one even better. I had someone who came in from out of town, and they wanted that done that day. And we so happened to have time. We did their scans. We told them they were a candidate. We did their smile design, and we did their surgery in the chair in the same day that they came in, and they walked out with fixed upper teeth.
And really, in one appointment.
Oh, it was awesome.
But that's not how you normally do it, though.
No, it's not. We made an exception because he came from out of town. But yes, it's possible, and we do it. And ideally, they'll come in a week later, and we'll do everything the normal pace. But if they need it the same day, we could do it the same day too.
Now, your pricing. We've done some research, and this is by design. You're like 10, 20% less than the big guys.
Randy, we're more than 10, 20% less. I promise that anyone who comes in will not be able to find a better price for the same product.
Is that right?
Yes, I really love what we're doing, and so I want to make it accessible to as many people as possible.
How are you able to do it for less?
Everything's in-house. Everything. I don't have to depend on anyone for any step. So when we do everything in-house, we absorb a lot of the costs.
Meaning they make
the lab,
teeth there,
we order implants for the whole year. Everything's bought in bulk. We do so many of these. We do at least, I would say maybe more than 1,500 implants a year. And so, number one, we have to keep updating our website. Number two, who cares about that? We buy everything in bulk, and we really do our best to pass on the savings to the patient, because at the end of the day, we want to keep helping more and more.
How do they make an appointment? Do they go online, do you prefer, or just call your office?
No, we really like human interaction. I can't stand calling somewhere and getting a robot or getting some AI, anything. We value that a lot, and we like to make personal connections with every patient of ours. And that's what we stand for, and that's one of the things that they love the most. Every time they call us, they get us. They don't get some other person who's not related to us.
I want to thank you for coming to the show. Good stuff.
Randy, thank you for having me. It was a pleasure.
Thanks. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.